And please feel free to use the chat section of Zoom to ask questions. We will be leaving time at the end for Q&A. Right now, people are muted who are participants, just the speakers are unmuted. And feel free, you don't have to be on camera, so you can turn your cameras off. But we will be leaving time for question and answers, and if you are so inclined, please feel free to put it in the chat section, and I will be moderating that. All right, so with that, I'm going to turn over to my colleague at Resolve, Tracy Sullivan.
Hi, everyone. Thank you for joining. My name is Tracy Sullivan. I'm the Grassroots Outreach Manager at Resolve. I wanted to first start off with introductions from our panelists and to give our partner organization, Family Equality, a chance to introduce themselves and the work that they do. So I wanted to start with Shelby Day. Shelby, can you provide the audience with an overview of Family Equality and also talk about your role in the organization?
Yes, so thank you so much, and thanks to all of you at Resolve for inviting us today to join you with this kitchen table conversation, and also for all the work that you invite us to do along with you. We greatly appreciate that and value that work. So I am the co-director of State Policy and Senior Policy Counsel at Family Equality, and we are a national organization. Our mission is to advance legal and lived equality for lesbian, gay, bisexual, transgender, and queer families, and for those who wish to form them, through building community, changing hearts and minds, and driving policy change. So my job has to do largely with the driving policy change piece of that. And as part of our work, what we envision kind of in a nutshell and what we work towards is a future where all LGBTQ families, regardless of creation or composition, live in communities that recognize, respect, protect, and value them, that every LGBT person has the right and opportunity to form and sustain a loving family, and that the systems of service and support are free from discrimination for LGBTQ youth in the child welfare system needing permanency, and LGBTQ adults seeking family formation through adoption, foster care, and assisted reproduction, and other means. And with us today, we also have my colleague, Julie Cruza, and I'll let her introduce herself. Oh. I think you're muted.
My name's Julie Cruza. I'm the Director of Federal Policy at Family Equality. So I lead national efforts to provide improved supports to LGBTQ people that have children, so LGBTQ parents, and as Shelby mentioned, young people, young LGBTQ and two-spirit people seeking family formation, and that would include foster youth and unaccompanied refugee minors. Shelby and I also co-chair with several other LGBTQ child welfare and faith organizations the Every Child Deserves a Family campaign. This is a campaign of over 600, as I said, LGBTQ, child welfare, faith, civil rights, health, and other organizations that are seeking to end discrimination against LGBTQ people and other marginalized families and youth, especially families and youth of color, within the child welfare system, and to dramatically improve care for LGBTQ families and young people in the system. And one aspect of this is that LGBTQ families are 4 times more likely to have our children removed from the system. So while we work to make sure that LGBTQ people can form our families, we also work to protect our families from discrimination once formed.
Wonderful. I'm gonna pass it on to some of my colleagues from Resolve. Betsy Campbell. Would you mind introducing yourself?
Sure, thanks Tracy. This is Betsy Campbell. I'm Chief Engagement Officer for Resolve. And in that role, I have the honor of working with our volunteers across the country who deliver on Resolve's programs and services in their communities. And I also oversee our access to care initiative, primarily our state advocacy and also our coverage at work program. And we always enjoy partnering with family equality, as we believe that, you know, our voices are stronger when we come together. So delighted to participate in this webinar today.
Thank you, Betsy. And lastly, Amanda Rush, would you mind introducing yourself?
Sure, I'm Amanda. I am the Senior Manager for Resolve's Coverage at Work program. I work alongside Betsy and Tracy as part of the Access to Care team. And I'm very excited to be here to be talking with you all today.
Wonderful. Well, thank you all for introducing yourselves and for joining us today. So we wanted to start off the conversation by asking Family Equality to provide an overview of access to care and family formation issues. Shelby and Julie, would you mind providing us with some background of history of access to care and some of the challenges faced and progress made?
Yeah, and I'll start us out with that. So first, I kind of wanted to start by just giving a little bit of an overview of our families. And so LGBTQ people have very diverse family structures, and we form families through prior relationships, different sex relationships, foster care and adoption, and assisted reproduction. And that includes, of course, donor insemination that can range from sperm donation, egg donation, embryo donation, to surrogacy, or all of those things. And so, our families, like I said, are very diverse. And what we've seen historically is that the legal and social climate for LGBT people has had a direct impact on LGBTQ, on the ways that LGBTQ people form families and become parents. So, in the face of an anti-LGBT legal and social climate, historically, LGBT people tended to come out later in life, and oftentimes after having had a different sex relationship. And so even today, although this is changing kind of up until today, most children who are being raised by same-sex couples were conceived in a prior different sex relationship. And I think that comes to a surprise to a lot of people. I have to admit, even for me, when I was digging into the research around this, which a lot of it has been done by the Williams Institute at UCLA, I was actually surprised. I hadn't thought about it in that way, especially post-marriage equality. But what we know is that the trend's changing as the legal and social climate has become more accepting of LGBTQ people, same-sex relationships, especially with marriage equality, and also with greater access to assisted reproduction, both from a medical standpoint and as assisted reproduction also has the technology has gotten better, it's become more available, more accessible, and the laws have started to be more accessible and protective of and inclusive of our families as well. Today, LGBTQ people are coming out later in life, and an increasing number of same-sex couples are planning to create their families inside of a same-sex relationship and with assisted reproduction, as well as adoption and foster care. So historically, and Julie's going to talk a little bit more about some research that we had commissioned and sort of where we are today looking into the future, but before she does that, I just wanted to say that historically, assisted reproduction laws have not always contemplated LGBTQ people and didn't always include, in some cases, didn't always include same-sex couples, even married same-sex couples, pre-marriage equality, or single people. And with that, we see the fact that there are donor laws in existence, and we see an increasing number of those, but there still are requirements in some places, even where they actually have expressed donor laws that, for example, if a lesbian couple is using a sperm donor, then it has to be provided in a certain place in a certain context, so by medical providers in a clinic. And so there still are laws that, it's important that people are aware of to know in what ways they can access and protect themselves. And then some of the assisted reproduction laws around insemination, parentage, and surrogacy have only applied to married married couples, historically. And of course, pre-marriage equality, this excluded same-sex couples. So with nationwide marriage equality starting in 2015, there's been greater access and greater inclusion, even where you still have laws that are gendered, which we're seeing a shift to changing some of those. It's created greater access, and of course, there's also been litigation and changes in laws that have advanced us forward as well. And I'm hoping that we can talk a little bit more about that. That's, adopting Uniform Parentage Acts, advances in surrogacy, new surrogacy laws like New York's law, which I'm hoping Betsy will talk about. But first I wanted to let Julie sort of kind of bring us forward to where we are now and in the future with some recent research.
Oh, Julie, you're muted.
And before I mention the research, I just want to mention what I've liked to have mentioned at the beginning, and I put in the chat channel that Family Equality greatly appreciates our collaboration with Resolve. We are so thrilled to have won really the best surrogacy law in the country together in New York over the last year, and to move the Every Child Deserves a Family Act forward together in Congress. And Speaker Pelosi told us we needed to get to 200 co-sponsors on that bill. And we were at 199 co-sponsors, and following the Resolve Lobby Day recently, we got 3 new co-sponsors. So you pushed us over the finish line of that particular goal, and for that we are truly grateful. So I will build on what Shelby said. I'm older than Shelby, so I'm less surprised that LGBTQ families traditionally are families that had children in prior heterosexual relationships. That's how I raised my kids. They were kids that my ex-partner had given birth to when she was in an opposite sex relationship. And it's been great to watch the kind of increase in options for LGBTQ parents. So we did a study, a large study on LGBTQ young people to see what their plans are for family formation. And key findings are that 63% of LGBTQ millennials want to become parents, which would, if they move forward with those plans, would more than double the number of LGBTQ parents. And by the way, I don't know if Shelby mentioned, but trans people have parenting rates similar to gay and lesbian people, if not higher. So definitely that's inclusive of the entire gamut of our community. And 48% of LGBTQ millennials are actively in the process of planning to grow their families, compared to 55% of non-LGBTQ millennials. So the gap between LGBTQ and non-LGBTQ people and plans for forming families is dramatically shrinking. And 63% of LGBTQ people planning families expect to use assisted reproductive technology, foster care, or adoption to become parents. So a significant shift away from where older generations where children were conceived through intercourse. And out of this study, we did a second report, and I will link to both of the reports in the chat function. But the second report is on the price of parenthood for LGBTQ families. And there we look specifically at the barriers to low-income families to family formation. And our findings included that 29% of all LGBTQ respondents reported an annual household income of $25,000 compared to 22% of non-LGBTQ respondents. So LGBTQ people are more likely to live in poverty and face the barriers that poverty forces on the people for family formation. And those numbers are higher. So 33% of Black LGBTQ respondents, 32% of female LGBTQ respondents, and 31% of trans and gender nonconforming LGBTQ respondents reported annual household incomes below $25,000. But regardless of income, 45 to 53% of these millennials are planning to become parents. But how they are planning to become parents is different. So LGBTQ households making over $100,000 are considering a full range of paths to parenthood, from surrogacy to private adoption to foster care to IVF. And the most popular options are adoption, foster care, and then thirdly, IVF or reciprocal IVF. At the other end of the economic spectrum, so those earning under $25,000, actually the #1 choice for family formation is intercourse in those families, followed by foster care and then adoption. So you can see that for low-income people, some of the technologies that are available for family formation are not even under consideration for the cost. And this just reminds me of a platform position that Senator Gillibrand, when she was running for president, had. She had a family formation rights platform that had a few components, but one was to end discrimination in foster care and adoption, so everyone could access that system. And the other was to provide financial supports to low and middle income people, because even for middle income people, this can be very expensive, for surrogacy, IVF, and other family formation options. So it was a universal access to parenthood rights platform. And I thought that this is a great way to view that. And this is also why I value our partnership with Resolve, so that we can have a holistic approach where all of the options that should be open to everybody are open to everybody, regardless of sexual orientation, gender identity, or economic status.
I just wanted to add one thing to what Julie said, that, you know, one consideration as we think about greater access and more intentionality of people creating their families earlier in life and within existing relationships is also options and access that allows transgender people to preserve their reproductive capacity prior to transition. And of course, a big piece of that is the financial and the insurance piece, as well as access to healthcare. So I didn't want that to be left unsaid.
Thank you so much for sharing those important points. And, you know, I definitely encourage everyone to check out the survey. There's going to be, oh, Julie just put a link in the chat. And for anyone who's listening to it recorded, we'll also include that as well, so that you can, you know, view it and go through it. I'd also love to loop Betsy in and talk a little bit more about insurance coverage through legislative efforts. And Betsy, could you provide us with some details about the history of state legislative efforts, victories, and challenges, in relation to access to care and family formation?
Certainly. Thanks, Tracy. So Resolve believes that everyone has a right to build a family and deserves access to all family building options. And as Julie said, we know that cost can be a major obstacle to building families. And so Resolve has been working since the 1980s to get fertility treatments covered by insurance. Today, there are currently 19 states with some sort of infertility insurance law, 13 of which cover IVF, which is the standard of care for many patients. However, because of the way infertility is defined in the older laws, the LGBTQ+ community is not always covered. So we have been working to update these laws to be inclusive and make sure that any new laws passed are LGBTQ+ friendly. To date, we have been successful updating or passing new laws in Colorado, Delaware, Maryland, New Hampshire, New Jersey, and New York. And our recent victory in Colorado earlier this year was based on model legislation developed by Resolve with input from diverse stakeholders to be inclusive of the LGBTQ+ community. So we hope to introduce that legislation in more states in 2021 and beyond. So basically, our advocacy work underscores our shared commitment to help all people struggling to build a family realize their dreams of family.
And Can I add one thing? First, just thank you so much for your work. I mean, we're so appreciative of the access work you're doing. I just wanted to point out, I mean, it really is in many states, and for my family, you know, even with really good health insurance, we're talking about insurance not covering insemination and visits with the fertility doctor, and all the way up to IVF, which we know gets very expensive very, very quickly. And then of course, you know, many times also surrogacy. And so, you know, it really is the full range of what's not included. Yeah.
Right. Very true, very true. And, you know, many of these laws passed decades ago, and it was only in 2018 that Delaware passed a comprehensive, inclusive infertility law after 13 years of no such legislation. So really, we're just looking in, you know, the past few years where we've been able, and part of that was because there was so much discussion with the Affordable Care Act and states were afraid to do anything. But we definitely now are working as much as possible to update these laws and to pass new laws to help everyone who faces challenges in building a family.
Great. And if anyone, you know, is interested, both Resolve and Family Equality on their websites talk about, you know, different state and federal legislative efforts that are ongoing. So definitely make sure to check those out and see if there's anything going on in your state to get more involved. I wanted to transition and talk a little bit more about foster care and adoption, also as other options for family formation and family building. Shelby and Julie, can you start this off and talk a little bit more about what's the, you know, political landscape and legislation happening now in regards to foster care, and maybe talk a little bit about adoption discrimination as well?
Yeah, so I'll start out kind of talking about the state perspective about this, and then Julie also has a lot to say about what's going on the federal level as well. But as I said earlier, so one of the ways we form our families is through foster care, foster to adopt, as well as private adoption. And probably no surprise that historically we've faced the LGBTQ community has faced discrimination in this realm, both in the child welfare world, but also in private adoption laws as well. So there have been states historically that outright prohibit LGBTQ people or same-sex couples from fostering or adopting. Thankfully, over time, we've seen that change. It's only been within the last few years that we actually saw the last state law get overturned. I believe it was the last state that had an outright prohibition that got overturned. But it's really been like in the last decade that that's happened. And so now there are no outright prohibitions, but we still know there's a lot of discrimination that occurs against prospective and existing parents and families of origin, as Julie said, as well as LGBTQ youth in the foster care system. And so even though we don't have any laws that expressly allow discrimination, what we've seen, which has been a major shift since 2015, that seems to be a response to our finally getting marriage equality, is states enacting laws that basically allow taxpayer-funded, in most cases, agencies to turn anyone away who doesn't meet their religious litmus test. And so these laws, generally the primary target are the LGBTQ community or same-sex couples, although their reach goes far beyond that. It could be a divorced person, a single person, person with other religious beliefs, and we've actually seen this play out over time. But there's currently 11 states with those laws. A large part of my work on the state policy level has been trying to defeat those laws. And we've been successful in many cases, but yet we still have 11 all but 2 of those laws have passed since 2015. And only 3 of those states don't apply directly to taxpayer-funded agencies. And so those are organizations, of course, that are doing the work of the state and are discriminating with state dollars in a way that the state itself could not do. And so we're working to fight those. Within the foster care and adoption process, what I will say is that each state, when we're talking just purely adoption laws, each state has their own set of laws. This is generally a state level issue. And post-marriage equality, no matter how the law is written, all married couples should have access to adopt and adopt together. This wasn't always the case pre-marriage equality. Many state laws were written to say, a married man and woman could adopt. So pre-marriage equality, unless a given state had marriage equality, that excluded same-sex couples. There are, I believe, 16, some states still allow unmarried same-sex couples to jointly adopt. And there are, I think, 16 states that allow married same-sex couples, the non-birthing parent, to adopt and have legal rights to become a legally recognized parent, which I'll talk more about later. But it really is a state-by-state issue, and it really, I think with all of this, it's so important that if you're looking into any of these issues, that you talk with an attorney in your state who has expertise in this area and has specifically worked with LGBTQ people or same-sex couples. So we also have seen a shift with adoption and foster care of states doing really good non-discrimination work. So recently we've been working as part of a small task force with the state of New Mexico, Inequality New Mexico, and Lambda Legal and some others to try to get their already good non-discrimination provisions even better. And one of the things that they have done recently is the secretary of their Department of Children, Youth, and Families signed a policy directive that has a very comprehensive non-discrimination statement of a list of non-merit factors of which you cannot be discriminated against, whether you're a prospective parent, foster adoptive parent, a child in care, or a family of origin. And of course, that includes sexual orientation and gender identity. So we're hoping we'll see more and more states do that work of actually proactively enacting non-discrimination policies, regulations, and statutes, and that's part of our work as well. But unfortunately, in this climate, we are spending a lot of time and more time, fighting the sort of new wave of discriminatory efforts. So as part of that, there is a Supreme Court case that I think everybody should be aware of. It's called Fulton versus City of Philadelphia. It's the next LGBTQ case before the US Supreme Court. It will be heard in the next session. The briefing is occurring right now. We'll be submitting an amicus curiae brief or a friend of the court brief in support of the City of Philadelphia. But in a nutshell, that case will decide whether a taxpayer-funded faith-based agency has an exception under the First Amendment, either free speech or free exercise of religion, to use that taxpayer funding to refuse to license same-sex couples or turn away LGBTQ people or others who don't meet their religious criteria, even in the face of city or state's specific non-discrimination provisions. So in that case, we're supporting the City of Philadelphia. The ACLU has also intervened on their behalf. The district court and the Third Circuit ruled the way that we would want to. They said, no, you cannot. There is not a First Amendment exception. You cannot discriminate. You're not exempt from the non-discrimination provisions that apply equally to any contracted agency. So we're hopeful that the US Supreme Court will find the same way, but you should stay tuned and be aware that that is working its way through now the US Supreme Court over the next year. So with that, I'll turn it over to Julie to talk about all that's happening on the federal level in this realm.
Well, and of course that is on the federal level. It's an excellent segue. I would add that another intervener in the case is Philadelphia Family Pride. So it's an LGBTQ parents organization that, like the ACLU, is an intervener in the case. And we're really proud of our families standing up and taking this all the way to the Supreme Court. The other thing I would note is that the Congressional Amicus brief is being written by Senator Gillibrand, and John Lewis was leading the effort to write that as well. So John Lewis has really been our national champion to protect our rights, and we are devastated by his death. And last year at a briefing, and you can see his briefing remarks on the everychilddeservesafamily.com website, you can see that he told us all to continue to fight on, speak up, speak out, and make good trouble until we win and pass the Every Child Deserves a Family Act. And I just want to say that in every step of what I'm going to refer to next, which is the Trump administration's attacks on LGBTQ families and our ability to form families, John Lewis was there every step of the way, every step of the way. But let me turn to that story. And one thing I just want to mention that I think is also worth mentioning in the context of the Black Lives Matter protests and John Lewis's passage is that what we find is that the families that are discriminated against the most and the kids that suffer the worst harms in the foster care system are those with intersectional identities. So LGBTQ foster youth of color or who are Native American. So we worked with John Lewis last year to really rewrite the Every Child Deserves a Family Act substantially to address those disparities that are at the intersection of race and sexual orientation and gender identity. And we're very proud of that work, and we'll continue to move forward with that work. And I think that is especially notable. I was on a phone call recently about Trump's most recent child welfare executive order, and Kellyanne Conway was on the call, and the Assistant Secretary at HHS was on the call. And there were organizations complaining that they could no longer carry out foster care services and live their faith, meaning turn away LGBTQ people and people of other religions. But there were also white parents concerned that they were not able to any longer fast track adoptions of children of color. Whereas the goal of foster care is primarily to return children to their family of origin when that's possible. And so I really worry what another Trump administration will produce for LGBTQ families and LGBTQ children, but particularly those who are children of color. Sorry about that. So that said, so I think you just can't tease all those issues out, but just to give a short history of what the Trump administration has done to attack LGBTQ families and children and our ability to form families over the last 2 years, is that in January of 2019, HHS issued a waiver so that a foster care agency, Miracle Hill Ministries in South Carolina, which I believe is the largest foster care agency and serves about 1/6 of the foster children in South Carolina. They have policies that if you want to be a foster parent, you have to have a pastoral letter showing that you are a born-again evangelical Christian. And so they are turning away Catholics, they are turning away other Protestants. And you have to sign a waiver saying that marriage is between a man and a woman, and that transgender people don't exist, that gender transition is not possible. So a Jewish foster mom who had fostered 14 kids in Florida, moved to South Carolina, wanted to become a mentor at Miracle Hill Ministries, went through a 2-day training, and then was told, oh, you're Jewish, sorry, you can't work with us. And she went to the South Carolina Child Welfare Agency, and they of course said, to Miracle Hill Ministries, you can't do this. It's against federal regulation because federal regulation bars religious-based discrimination in any HHS-funded service, and including foster care. And so she went to the governor and the state legislature, and the governor issued an executive order allowing discrimination to continue. The state legislature passed a law allowing discrimination to continue, but the governor also asked HHS for a waiver allowing this discrimination to continue. And the Trump administration provided that waiver and said any faith-based organization in South Carolina could turn away parents based on their religious beliefs. And that of course was a very frightening prospect, because we thought, well, then this could nationalize the issue if this kind of policy is allowed in other states. And I just want to point again that at that time, Jim Clyburn and Joe Cunningham from South Carolina joined forces with John Lewis and Danny Davis, who really, the two of them have led the fight together against discrimination in foster care, to speak out immediately on this, start a Ways and Means Committee investigation of it, and have been fighting this side by side with us every step of the way. But just a month later, Trump at the National Prayer Breakfast said that he did want to take this policy nationwide and continue to fund taxpayer funded agencies that turn away LGBTQ people. And I want to just note what Shelby said about the Fulton case that's so remarkable. It's not just that Catholic Social Services is saying we want to be able to turn away LGBTQ parents. They're saying we want to be able to turn away LGBTQ parents, and you have to give us money, even though we're not complying with your laws. Like, you must fund us. Like, freedom of speech is no longer we get to say what we think, but it's that you have to give us money, even though we're carrying out actions that are contrary to, your laws. So that is a truly remarkable development. And next, HHS put out a new rule stripping sexual orientation and tribal data from the foster care and adoption data system. And we know for both children and families. And of course, we all know that if you're not counted, you don't get services. So this was their way to further strip services from our children and families. And finally, in November of last year, remarkably, HHS did something which is unprecedented, which was say we're no longer going to enforce our non-discrimination rule. And this non-discrimination rule says you can't discriminate in any of HHS's $500 billion of services. Those services have gone under COVID up by hundreds of billions of more dollars. And previously, all those services prevented discrimination based on race, color, national origin, disability, sex, age, gender, sexual orientation, gender identity. And they said, we're no longer enforcing that during a pandemic. This was pre-pandemic, but they have continued to maintain that posture even in a pandemic, that all of these HHS-funded services in COVID response, that non-discrimination is also permitted in those. Family Equality and SAGE and True Colors and Lambda League on Democracy Forward have sued HHS over this notice of non-enforcement, because you can't do that. You can't just stop enforcing a regulation. You have to use other processes to do that. But HHS also issued a rule simply revoking all of those non-discrimination protections. And we're expecting that final rule out every day, any day now. That is truly frightening, that in a pandemic, families and children and individuals and elders may not be able to access needed services, including services to keep our families together, but also take care of the kids in foster care. To start excluding people from that when there's a crisis is just outrageous. So that is all of those are many of the reasons that we seek to pass the Every Child Deserves a Family Act in Congress, which would bar discrimination based on religion, sexual orientation, gender identity, or marital status in any foster care, adoption, or child welfare service, and would provide dramatic resources to states to improve care to our families and our children. And that includes resources to improve care to all marginalized children and families. And it also prohibits conversion therapy for LGBTQ kids in foster care. So we will put more information about that up in the chat, both about the actions that the Trump administration has taken and where you can join in to help with the Every Child Deserves a Family Act. And just in closing, I will say again, we really appreciate our partnership with Resolve and Resolve's central role in the Every Child Deserves a Family campaign to push back these horrible developments and to move forward and make this country better for everyone trying to form a family.
Thank you so much, and we'll definitely look in the chat for a link for more information. And we do have about 15 minutes left for the webinar, and we want to leave enough time for Q&A. So I'm gonna switch things around a little bit and have Amanda just talk for a few minutes about a newer program at Resolve called Coverage at Work. Amanda, could you provide us a general overview of this program, as well as where people can find additional information if they're interested?
Absolutely. Coverage at Work is a program that I've been a part of for a little over a year now with Resolve. Our purpose is to turn employees into advocates and have them approach their employers and ask for additional or expanded family building benefits, because as we've discussed, coverage for family building is very expensive. It isn't always covered by insurance. And so by making that ask, a lot of employers don't even realize that they have a gap in their coverage. And we found that with a toolkit that Resolve provides full of information, resources, template letters, they can make the ask, and employers are willing to take the steps to look into it and decrease that gap by offering assistance for IVF, adoption, surrogacy, etc. In addition to that, everybody who downloads the toolkit off of the Resolve website, and I will mention the website address in a second, can also opt into one-on-one coaching with the Resolve staff, which is me. So folks who are interested, who don't quite know where to start, they can go to resolve.org, one word, and I'll pop that into the chat after I'm done talking. And you can download the toolkit. You'll get an email with the toolkit in it, and you'll be able to talk to me in case you need any one-on-one coaching throughout the process.
I lost your audio for like a half a second, Amanda, while you were doing the URL, so I put it in the chat.
Okay, great. Thank you so much.
Perfect. So if people have questions, please feel free to pop it into the chat, and we will read them out loud for people to take. But I wanted to ask sort of family equality and Resolve, if someone is new to advocacy and interested in legislative efforts discussed, how can they get further involved in advocacy efforts? So maybe we'll start with Betsy and then move to Shelby and Julie.
Great, thanks. Yes, well, we welcome everybody to get involved in our advocacy networks. We have a Resolve advocacy network that people can sign up to receive information and guidance. We have a state advocacy toolkit that can be downloaded. We have ways to get involved in Federal Advocacy Day and State Advocacy Days. So really the best thing to do is to go to resolve.org, and there is at the top where it says get involved, there's a link to become an advocate, or feel free to email info at resolve.org, and we'll get you everything you need to start advocating with us.
And I can mostly say ditto to what Betsy said, where we have a very similar model. You can go on our website, familyequality.org, and sign up for our email list. We have national and state-specific emails, both updates and action alerts if we're working on specific actions or legislation. Julie also put in the chat the link for the Every Child Deserves a Family campaign, which has both a national and a state component. So we'd love to have you join that as well. And wonderful. We, of course, want as many members as we can have and want people to stay aware of the work we're doing and our issues generally. So we would love for all of you to join us.
Perfect. Yeah, so definitely check out the links and do the opt-ins and sign-ins for different opportunities and ways to get involved. And I wanted to loop a little back with Shelby, Julie, and Betsy to talk about, we only have a few minutes left, but I'd love for you all to touch a little bit about parentage and surrogacy. So maybe discuss just sort of in a broader overview of what parentage is and why is it important. And then we, Betsy, maybe talk about some of the New York legislation that just really excitingly changed regarding surrogacy, and maybe some of the challenges of surrogacy that families face. So maybe we'll start with Betsy talking about some of the exciting things for surrogacy.
Sure. Well, as I said earlier, Resolve supports all family building options, including gestational surrogacy. For the heterosexual community, gestational surrogacy is often a last resort, while as for same-sex couples, it may be the only option. We believe it should be legalized nationally to help everyone access this option. And we've worked tirelessly to overturn harmful gestational surrogacy laws or anti-surrogacy laws in New York and Washington, D.C. And as mentioned, we were successful, just last year in New York, well, actually this past year in New York, which had, to most people's surprise, a law that outlawed compensated gestational surrogacy and did not recognize any surrogacy arrangement. So people in New York had to go outside the state, which creates a huge hardship. So we partnered with Family Equality Council through their Protecting Modern Families Coalition. And this was after years and years of, talking about this issue and trying to get support. And finally, everything aligned this year. Governor Cuomo put the Child Parent Security Act in his budget. So now, starting next year, families will be able to stay in New York, and if they need a gestational carrier to build their families, they can now do it legally. So this was really an important step. There's still a couple of other states that ban surrogacy, so we'll, try to do the same thing in those states. And sadly, we still are fighting anti-surrogacy laws in states that want to try to ban this family building option. So we have to be very vigilant, and we are always tracking state legislation to make sure that no bad bills passed and that we can, advance pro family building laws anywhere we can.
Thank you so much for sharing, Betsy. And with a couple of minutes that we have left, yeah, Shelby, I'd love it if you could, touch upon parentage and provide some highlights on that.
Sure. So when we talk about parentage, we're talking about making sure that, you know, any person who's intended to be a parent of the child is legally established as their parent. And so with a same-sex couple, you know, generally you have a birthing parent or a biologically related parent who has rights that are legally established, but what we often call the non-biological parent or the non-birthing parent may not be recognized in the eyes of the law. So post-marriage equality, if the child's born into the relationship, then the child is recognized or should be recognized as a child of both parents and on the birth certificate. But that does not establish legal parentage. It reflects a presumption in the law. So there's a lot of vulnerability there for families. There are different ways to establish that parent-child relationship between the child and the non-birthing parent. Or the non-biologically related parent. So you have in the case of New York and a handful of other states, what's called a voluntary acknowledgement of parentage, which is a form that can be signed in the hospital or that the state department that handles that issue would also have that available after the family leaves the hospital, and basically both the parent the woman who birthed the child and the other intended parent will sign that and be acknowledged as a legal parent, and that should be recognized in the same way a court order would be. The most recent to pass is just this week. The Rhode Island legislature passed a comprehensive bill that included a voluntary acknowledgement of parentage. So this is a huge advancement, but because it's still new, there's still some vulnerability. So we're still suggesting that people take the extra belt and suspenders approach of either establishing that legal relationship through a confirmatory adoption. So in some states, that's a step-parent adoption process or a second-parent adoption process. It's available to all married couples now in all 50 states. And as I said earlier, in about, I think, 16 states, it's also available to non-married or unmarried couples. There are also some states have the ability to obtain a declaratory judgment of parentage or other parentage judgment that's a court order establishing both parents as legally recognized parents. And then also, you know, the kind of law in New York that Betsy was talking about, the Child Parent Security Act, and other sort of comprehensive laws, be it with surrogacy and assisted reproduction, or we see some states moving towards adopting the Uniform Parentage Act or many provisions within that act. Also, as part of assisted reproduction, will acknowledge or allow for a process that tends to be more streamlined to establish both parents as the legally recognized parents, be it intended parents in surrogacy or a couple going through IVF or using donors. And so those laws are very, very important. And you know, again, we're working, you know, oftentimes with you all on these, trying to get these laws passed and fight discriminatory laws, but also, you know, working in other realms for more states to pass the Uniform Parentage Act or enact legislation that would allow parentage to be established more easily, so that all parents are recognized, and that benefits both parents and the children, to make sure that the child is sufficiently recognized vis-a-vis their parent-child relationship for all the responsibilities and benefits that come with parentage.
Thank you so much for providing that overview, Shelby. That was really helpful. We are just closing up and have about hit time. So I just wanted to thank, you know, Family Equality so much for joining us today, Julie and Shelby. It's always so wonderful working with both of you, and you know, Amanda and Betsy and Rebecca, thank you so much. And if we didn't get to your questions, definitely feel free to, or if you have additional questions after viewing this recording, definitely feel free to send them our way. I can provide Resolve's info box email that you can send information to. And please, definitely check out our websites. And like I said, we have, different, action alerts and state and federal legislation going on that you can review. Family Equality, check out, that great survey that they did to learn more information. And yeah, thank you all.
Thank you. I think we did our first kitchen table conversation very well with this important topic. I think, 46 years after Resolve's founding, it's amazing what we're still all facing. And I echo the love fest that we have going on between the two organizations. And we invite you guys back to our kitchen table anytime. We'll catch up soon.
Thank you so much.
Thanks, everybody.
Thank you.
Thanks for joining us.